Hi, welcome back to Easy Ayurveda classes, and today we'll be studying the BAMS first year syllabus, that is shoulder joint. And any one joint they will ask 200% for the 10 marks question. How much? For 10 marks 200% they will ask. So first one is the shoulder joint, and it is also known as the Amsa Sandhi in Ayurvedic or Sanskrit. And which type of joint it is? Anatomically it is the synovial joint. Synovial joints all are the ball and socket joint. Next, functionally it is diarthrosis, that means freely movable joint. So these 2 points writing in exam is compulsory. At least first one is 200% compulsory. You have to write that. Next one is articulating surface, that means shoulder joint is formed with how many bones? That is known as the articulating surface. So glenoid cavity of the scapula, this is scapula. From scapula, glenoid cavity, and the head of the humerus, that is humerus, and it is the scapula. These two are the glenoid cavity. These two are the articulating surface for the shoulder joint. Next, blood supply for the shoulder joint: anterior circumflex humeral artery and posterior circumflex humeral artery. See, this is a humerus bone. From above it is going, that is known as the anterior circumflex of the humeral artery, and if it is going below, that is known as the posterior circumflex of the humeral artery. Next one is the suprascapular artery, that the artery that supplies the scapula, because scapula is also involved in the shoulder joint. Next is subscapular artery. Next, nerve supply for the shoulder joint include axillary nerve, because it is in the shoulder joint formed in the axillary region, so important, axillary nerve. Next one is the suprascapular nerve. Next, movement that are included in the shoulder joints come. First, flexion. Flexion is the movement that is conducted by the shoulder joint, and which all are the muscles that are involved will be: first one will be the pectoralis major and deltoid muscle. Extension. Flexion means if you bend your hand like this. Extension means if you open your hand like this. At that time, main involved muscle will be latissimus dorsi. Adduction means if it is hand here raised like this, if you bend this like this, no, that is known as the adduction. For this, biceps, triceps, these two are important. Next, adduction, if you open, if your hand is like this cold, if you open it, and that is known as the deltoid, and at that time the muscle involved will be deltoid. Next one is the medial rotation. If you started rotating medially, at that time muscles involved are the pectoralis major and teres major. If lateral rotation, if you rotate outside, then it is no muscle involved will be deltoid and teres minor muscle. Opposite to this, here it will be included. If it is teres major, here will be teres minor. Here pectoral major is there. Opposite to this, always involved muscle will be deltoid muscle. Next, clinical features are: if dislocation is occurred due to small size of the glenoid cavity. See, glenoid cavity is present in scapula. So if something happened, then dislocation happens from the scapula. Next, frozen shoulder, important for the MCQs. Elder edge pain due to inflammation of the synovial membrane. For every joint, you'll observe synovial membrane. If that is inflammation occurs, then frozen shoulder is observed. Next, shoulder tip pain. Pain in the shoulder from diaphragm or pharynx nerve. See, just remember, shoulder tip pain observed due to damage of the pharynx nerve. After this, you have to write the ligaments involved. Ligaments involved are the coracohumeral ligament, that the humerus ligament. Next, transverse humeral ligament. These two are the ligament involved in the shoulder joint. If you know some more, just write it again, ligaments, and draw the diagram for that all for the shoulder joint. So that will be fetch you more marks if you draw diagram. So this much is the shoulder joint. In my next video, you'll get to know about the elbow joint, hip joint, and knee joint. If you like my video, please like, share, and subscribe to my channel, because it takes more time for me to create videos for you. So please consider that effort and subscribe to my channel. And thank you for watching.